Welcome to this tutorial on Xenobiotics, brought to you by Medical Biochemistry Power Capsule Series. This video covers the following CBME curriculum topic: describe the role of xenobiotics in disease. Xenobiotics are chemical substances that are foreign to an organism's normal biochemical processes. They can enter the body through various routes, including ingestion, inhalation, and dermal contact. Xenobiotics encompass a wide range of substances, including pharmaceutical drugs, environmental pollutants such as heavy metals, pesticides, and air pollutants, food additives like preservatives, artificial sweeteners and colorings, and industrial chemicals. Understanding xenobiotics is crucial in medicine, as they can have both beneficial and harmful effects on human health. Medical professionals need to be aware of the potential interactions and side effects of pharmaceuticals and other chemicals. Sources of xenobiotics include pharmaceuticals, which are medications designed to treat various medical conditions; environmental pollutants, such as chemicals released into the environment from industrial activities, agriculture, and waste disposal; food additives, such as substances added to food for preservation, flavor enhancement, or color; industrial chemicals, including compounds used in manufacturing processes, such as solvents, pesticides, and plastics. The common routes of exposure include ingestion, consuming contaminated food, water, or medications; inhalation, breathing in airborne pollutants or chemicals; dermal contact, absorption through the skin, particularly from personal care products or occupational exposure; directly into bloodstream through injection. The biochemical processes whereby noxious substances are rendered less harmful and more water-soluble are known as detoxification. Xenobiotics are metabolized and rendered less toxic before being excreted from the body. Liver is primarily responsible for detoxification. Organs involved in elimination include kidneys, lungs, and intestines. Human exposure to environmental xenobiotics, such as heavy metals, pesticides, air pollutants, and industrial chemicals, can occur through inhalation, ingestion, or dermal contact. Occupational exposure, urbanization, industrial activities, and agricultural practices contribute to environmental contamination. Environmental xenobiotics pose risks to human health, with potential consequences ranging from acute poisoning and respiratory disorders to chronic diseases such as cancer, neurological disorders, reproductive dysfunction, developmental abnormalities, etc. Vulnerable populations, including children, pregnant women, the elderly, and individuals with pre-existing health conditions, may be at increased risk of adverse effects. Drug-induced toxicity is a matter of concern. Adverse drug reactions can range from mild symptoms to life-threatening conditions, thereby affecting various organs and systems. Drug-induced toxicity refers to adverse effects caused by pharmaceuticals during therapeutic use. Pharmacovigilance involves monitoring, detecting, assessing, and preventing adverse drug reactions throughout the drug life cycle, from preclinical development to post-marketing surveillance. Drug-induced toxicity can result from various mechanisms, including direct tissue damage, immune-mediated reactions, idiosyncratic responses, metabolic activation of prodrugs, and off-target interactions with cellular macromolecules, genetic predisposition. Drug-drug interactions and patient-specific factors contribute to individual variability in susceptibility to adverse drug reactions. Paracetamol causes liver toxicity in high dose. NSAIDs can cause kidney damage. Methotrexate causes bone marrow suppression. Gentamicin can cause kidney damage and hearing loss. Statins may cause muscle toxicity and liver damage. Antipsychotics may lead to diabetes and weight gain. Antidepressants may cause serotonin syndrome. Digoxin cause arrhythmias. Anticoagulants can precipitate bleeding. Opioids can cause respiratory depression. Xenobiotics can exert toxic effects on specific organs or systems, leading to organ toxicity. Common targets include the liver, kidneys, cardiovascular system, central nervous system, hematopoietic system, and gastrointestinal tract. And so we have hepatotoxicity, nephrotoxicity, cardiotoxicity, neurotoxicity, hematotoxicity, and gastrointestinal toxicity. Metabolism is a critical determinant of xenobiotic bioavailability, efficacy, and toxicity. It can lead to the activation of prodrugs into active metabolites, detoxification of harmful substances, or the formation of reactive intermediates that can cause cellular damage. Understanding xenobiotic metabolism is essential for predicting drug-drug interactions, designing safer medications, and assessing the risk of environmental exposure to pollutants. Bioavailability is essentially the amount of the drug that can be absorbed and used by the body. Efficacy refers to how well a drug works in achieving its intended purpose. Xenobiotics undergo various chemical transformations in phase 1 metabolism, primarily in the liver. These transformations include oxidation, reduction, and hydrolysis reactions, often mediated by enzymes such as cytochrome P450. Phase 1 metabolism typically results in the introduction or exposure of functional groups, making the xenobiotics more reactive and amenable to phase 2 conjugation reactions. Phase 1 reactions include oxidation, hydrolysis, reduction, hydroxylation, dealkylation, epoxidation. This mnemonic should help you to remember the names of the various types of phase 1 reactions. Phase 1 metabolism involves enzymatic reactions that primarily occur in the liver's endoplasmic reticulum. These reactions aim to introduce or expose functional groups on the xenobiotic molecule, thereby making it more polar and reactive. Ethyl alcohol gets converted to acetaldehyde, which further gets converted to acetic acid. This is an example of oxidation. Nitrobenzene is converted to aminobenzene. This is an example of phase 1 reduction reaction. Aspirin is converted to salicylic acid, and this is an example of hydrolysis. Cytochrome P450 enzymes are inducible enzymes and are the major catalysts of phase 1 reactions. They catalyze oxidation, reduction, and hydrolysis reactions, leading to the modification of xenobiotics. More than 100 different cytochrome P450 enzyme isoforms exist, and more are being discovered by researchers, each with specific substrate preferences and tissue distributions. These are heme-containing enzymes. These are localized mainly in the endoplasmic reticulum of liver. These enzymes absorb light at wavelength of 450 nanometers when exposed to carbon monoxide. They are monoxygenesis. NADPH is the coenzyme for cytochrome enzymes. These enzymes can be induced by various drugs and chemicals, such as phenobarbital, ethanol, etc. Through functionalization reactions, phase 1 reactions often result in the formation of intermediate metabolites, some of which may exhibit increased toxicity or pharmacological activity compared to the parent compound. Methanol converts to formaldehyde, which converts to toxic formic acid. Ethylene glycol converts to glycolic acid and then to oxalic acid. Parathion converts to paraoxan, which is more toxic. Acetaminophen converts to NAPQI. Carbon tetrachloride converts into trichloromethyl free radicals. Following phase 1 metabolism, xenobiotics undergo phase 2 conjugation reactions, where they are conjugated with endogenous molecules to increase water solubility and facilitate excretion. Each type of conjugation reaction modifies the xenobiotic molecule in a specific manner, altering its physicochemical properties and facilitating elimination from the body. Common conjugation reactions include glucuronidation, sulfation, methylation, acetylation, glycine conjugation, glutamine conjugation, and glutathione conjugation. These reactions are catalyzed by specific enzymes, most of which are inducible in conjugation reactions. A molecule normally present in the body is added to the reactive site of the phase 1 metabolite. In most cases, the conjugation will make the compounds non-toxic and easily excretable. The various types of conjugation reactions and the active conjugating agents have been depicted here. And we have provided a mnemonic, which will help you to memorize this list. Please pause here and go through the list as well as the mnemonic. Therefore, phase 2 metabolism involves conjugation reactions, where phase 1 metabolites, or the parent xenobiotic, are covalently linked to endogenous molecules to increase water solubility and facilitate excretion. Conjugation reactions typically occur in cytosol and involve transfer of functional groups from co-substrates to the xenobiotic molecule. Some substances along with the transformed product after phase 2 conjugation reaction has been shown in the box alongside. Please pause here again and go through this list. The factors influencing xenobiotic metabolism include induction and inhibition. Xenobiotic metabolism can be modulated by various factors, including drugs, environmental chemicals, dietary constituents, and genetic polymorphisms. Inducers such as rifampicin and phenobarbital can increase the expression and activity of drug-metabolizing enzymes, while inhibitors like cimetidine and grapefruit juice can decrease metabolism rates. Polycyclic aromatic hydrocarbons, found in polluted air, can induce certain cytochrome 450 enzymes. Drug-drug interactions. Co-administration of medications can induce or inhibit the same metabolic pathway, and can alter the pharmacokinetics and efficacy of drugs, leading to adverse effects or therapeutic failure. Ciprofloxacin inhibits the metabolism of warfarin, leading to increased warfarin levels and risk of bleeding. Erythromycin inhibits the metabolism of simvastatin, which increases risk of muscle toxicity. Quinidine can inhibit the metabolism of digoxin, and this causes increased digoxin levels and toxicity. Genetic variation. Genetic polymorphisms in drug-metabolizing enzymes and transporters can influence individual variability in xenobiotic metabolism and response to medications. Pharmacogenetic testing can help identify patients at increased risk of adverse drug reactions or poor drug efficacy, allowing for personalized treatment strategies. Persons having polymorphism of alcohol metabolizing enzymes and an acetyltransferase enzymes metabolize alcohol slowly and are more prone to toxic effects. Adverse drug reactions. Pharmacogenetic factors play a significant role in the occurrence of adverse drug reactions. Understanding the genetic basis of adverse drug reactions can aid in the identification of high-risk patients and the selection of safer medication alternatives. Genetic variations in that gene may result in slow drug and xenobiotic metabolism in certain individuals. This influences drug efficacy and toxicity. Drug metabolism and efficacy. Variability in xenobiotic metabolism can impact drug efficacy and therapeutic outcomes. Patients with rapid metabolizer phenotypes may require higher doses of medications to achieve therapeutic effects, while those with slow metabolizer phenotypes may be at increased risk of drug toxicity. Drug development and safety. Knowledge of xenobiotic metabolism pathways is critical in drug development and safety assessment. Preclinical studies evaluate metabolic stability, metabolite identification, and potential drug-drug interactions to ensure the safety and efficacy of candidate drugs before clinical trials. Future directions. Personalized medicine, which actually refers to tailoring drug treatments based on individual genetic makeup and metabolism to minimize adverse reactions. Green chemistry, which involves developing environmentally friendly alternatives to hazardous chemicals and promoting sustainable manufacturing practices. Xenobiotics play a significant role in health and disease, with both therapeutic benefits and potential risks. Understanding their metabolism, effects, and regulation is crucial for healthcare professionals to ensure safe and effective patient care and environmental stewardship. Xenobiotic metabolism provides medical students with a comprehensive understanding of the complex processes involved in drug metabolism and their clinical relevance in personalized medicine and patient care.
Thanks for watching this video. Our next tutorial in the Medical Biochemistry Power Capsule series is titled Antioxidant Defense Systems. The tutorials presented in the MBPC series are not intended to be a substitute for your textbooks. However, we feel that these tutorials can prove to be very valuable as complementary educational aids and for purpose of rapid revision prior to exams. If you have enjoyed this video, don't forget to hit the like button, subscribe for more exciting content, and share with your friends. And do keep watching our channel to remain ahead in the game.